Respected Chairperson, thank you very much for inviting me here. This is my first visit to Durgapur in my life, and I'm really enjoying this moment. I took some pictures of the airport also, so thank you once again. My today's talk is a very non-traditional talk. Usually I talk on pregnancy diabetes, but Dr. Amitabh was behind me to talk on this particular topic, and I had a tough time of preparing this talk. And I'll try to do justice in a very brief time of next 20 minutes, if I'm not wrong. So, Metformin update on the mechanism and repurposing the potentials. My humble congrats and thanks from Diabetes to BD Corp. There is no conflict of interest for this particular session. So, I'll try to speak on introduction, glucoregulatory actions of metformin, new glucose lowering mechanisms of metformin. It will be very brief, and then how metformin is being proposed to be used apart from in diabetes, some other illnesses, and carry on message. If we just go through the history, this is Malaria officinalis. It is a plant which was actually from which metformin has been discovered, and this metformin was used in 1870s or so for influenza. In 1922, it was first synthesized from this plant, and then it became available in 1940 as a glucose lowering therapy. Got approval in 1994 by ADA, but we in India have started using it in 80s itself. So we have at least 20 years more experience of using metformin versus the Western world. And then in 2011 it has been approved by across all the bodies, and now it's the first line of therapy across. It is the first line therapy to treat type 2 diabetes, and more than 200 million patients daily take metformin. Unfortunately, the mechanism underlying its therapeutic action is still complex and not very well understood. Early evidences have highlighted that it is the liver as a major organ which is involved in the effect of metformin. But however, later on it was realized that it is the GI tract, the gut microbial communities, and tissue-resident immune cells which are possibly also involved in the action of metformin for getting all the different benefits on different organs. The high accumulation of metformin in the gut has been reported in the concentration of almost 30 to 300 fold times greater than in the plasma and the other tissues, suggesting that gut acts as an important metformin reservoir in both human and the animal model. It is now being tried in various clinical trials in chronic human diseases. Mechanism of action vary depending on the dose and duration of the therapy. Metformin targets the hepatic mitochondria. However, the identification of novel targets of low concentration of metformin at lysosomal surface might also reveal a new mechanism. Now, using this drug in cancer, age-related disease, aging, people say it's anti-aging drugs, inflammatory disease, and COVID has been also explored. So, when you talk about the metformin mechanism, it regulates the critical component of the glucose metabolism and insulin signaling pathway in various tissues. In liver, if I just use this pointer here, liver, it is at the mitochondria, it will reduce the respiratory chain complex 1, and it ultimately end up with increasing adenosine monophosphate, that is phosphate, that is AMP, and also will increase the activated protein kinase AMPK, and then ultimately will reduce gluconeogenesis. So metformin in liver, it will end up with reducing gluconeogenesis, that means the glucose formation from other than glycogen. In intestine, it will have a section directly. It has been shown in various studies that it increases the GLP-1 secretion. It reduces the glucose absorption from the gut. It increases the glucose utilization at the skeletal muscles and increases it being an insulin sensitizer. Reduces bile acid and reabsorption. And also now recently it has been shown that it has its action on the gut microbiota function. So it improves the gut microbiota function. At muscle again, it will improve the insulin sensitivity and reduce the insulin resistance, maybe through AMPK pathways or blood transporter activators, activating the blood transporters, glucose uptake and increase insulin sensitivity. Adipose tissue, again, it will increase glucose uptake, decrease leptin, it will improve insulin sensitivity by increasing adiponectin, increase fatty acid oxidation, and decrease adipogenesis. So by doing so, metformin has been shown not only as a good insulin sensitizer, but also has mechanism of action being understood in different organs, including liver, intestine, muscles, and adipose tissue. And this is how when your blood glucose goes up, this glucagon has a glucose receptor here in the hepatic cells, and then it is responsible for increasing cyclic AMP and causing increased blood glucose. But this gets inhibited because of the when metformin comes in through the OC transporter 1 into the mitochondria, it actually reduces ATP, which ends up with increasing AMP, and then this AMP increases AMP kinase, and then this actually causes the change in the ratio of AMP ATP, which reduces the formation of the cyclic AMP formation and reduces the glucose production, and that's how it reduces blood glucose. So it has been shown that it also has its action in the liver, and it has shown, the earlier speaker has already talked about the NAFLD. I'll not go too much into detail of it, but it has been shown that it might have its action even on those levels, including NASH and NAFLD. Though metformin has not shown in the most of the clinical trials a big benefit, and that's why the recommendation still of metformin is little question mark, but at least it's a drug which has shown that 50% reduction in the risk of hepatic cell carcinoma, and that's one of the very important thing here. Several studies have demonstrated 50% reduction in the risk of HCC in diabetic patients who were on metformin. Also, metformin in gestation diabetes is the only oral drug which has been approved by Government of India as well as most of the global bodies. Of course, the glepaglutide has also been approved, but then it is one of the preferred drugs after 20 weeks of the recommendation. Recommendation says after 12 weeks. European guidelines recently say that in gestation diabetes or as well as in pre-gestation type 2 diabetes, you can start metformin pre-conception and continue till delivery. And there is no, they had a MIDI trial, and this MIDI trial where they have used this metformin before conception and then continue till delivery without any neonatal issues. And that's why now they say metformin is a good drug and can be used in pre-gestation diabetes in Europe. Though India, we don't have such recommendation yet, and we still stick to Government of India guidelines. It also has been approved now in India last year for pre-diabetes, for prevention of diabetes to pre-diabetes, of course on the basis of DPP trial and DPPI trial, and then polycystic ovarian disease, oligomelia, and weight gain. Now, PCOS, it has been used commonly, though it has been not, and most of the gynecologists, they use it for fertility, and it is being licensed in few of the countries, but some of the other countries it is off limits. So there are multiple actions also have been proposed as anti-inflammatory action of the metformin with various mechanisms, and they have shown that it can be used even in patients with tuberculosis. It also prevents the multi-drug resistance, and it is through the type 1 interferon down regulation as well as the phagosomal persistence, oxidative change, and inflammatory matrix through various pathways. I'm not going to go in detail of it, but by increasing the ROS is one of the reactive species. If they are increased, they again deteriorates the thing. But antioxidant activity of the metformin and anti-inflammatory might be helpful in patients with tuberculosis. Has been proposed. There's also in SARC2, I think we had a lot of data which are coming with this. Those patients who are on metformin have been benefited. The exact mechanism again is not known, but they say that it has shown that they have decreased hospitalization, decreased inflammation, decreased mortality, decreased virus load, decreased long COVID, decreased inflammation, and so it is COVID-related complication as well as the vaccination-related complications are found to be less. Immunomodulator, it has been shown that it has its impact on some of in its coronavirus. It has been shown that it possibly has its action at the ACE2 receptors, and by having the effect on ACE2 receptors, it might be helpful in preventing the virus entry. And this again in the Qubix that they have also shown that there is a decrease in fibrosis as well as the thrombosis in these patients who were on metformin. Then there is also they have shown that by controlling metformin was those who were on metformin, these COVID patients, they have shown to have less inflammation and less inflammatory markers versus others. So if you just go through that it is anti-aging, they have been proposed that it is anti-aging, antiviral, anti-inflammatory, and they have some trial, but they were not very promising trial. The Together trial, they investigated whether early treatment with metformin could lower the risk of emergency care and hospitalization among the high-risk patients of COVID. However, the enrollment in this trial was stopped as the intermediate assessment indicated that metformin treatment had no effect on the outcome parameters. In phase 3 double-blind trial, which is COVID out, non-hospitalized adult with obesity and overweight, metformin treatment within 3 days of infection did not prevent the occurrence of hypoxia and emergency department visit or hospitalization or death. So this did not found to be. This is what happens in most of the, even if you go through the antioxidant trial, it has shown that it might be helping in the lab, but it may not be in the clinical practice. And this is the remodeling of the heart. Where you have metformin activation of the AMPK results in improved energy balance, improved mitochondrial function, inhibition of the fibrosis, and reduced generation of the ROS. AMPK also corrects the gap junction expression and improve the cell-to-cell coupling in the myocardium. And metformin reduces the generation of pro-inflammatory mediators, leading to reduction in the fibrosis and degeneration of the myofibrils in diabetic heart. Lastly, metformin also reduces the production of AGE, advanced glycation end products, as well as the receptor of AGE has been found to be reduced, contracting hyperglycemia, which also reduces ROS and tissue fibrosis. And this has also been shown in the animal models as well as of the human model. They have also shown that it might have the benefit in patients who have autonomic neuropathy. So metformin in an atrial fibrillation, they have found that it might have its effect through AMPK pathways, glucose transport and gap junction, and it might inhibit hyperglycemia, oxidative stress, inflammation and remodeling. And these are the effects of some data say that hyperglycemia, insulin resistance, oxidative stress, inflammation and atrial remodeling, all of this could be beneficial in patients with atrial fibrillation, those who are on metformin. This is not the treatment, but this is the retrospective data on those patients on metformin versus those who are not on metformin have found this findings. Then there is also effect on bone, and it has been again shown that it increases the bone formation through expression of various complex, and it also reduces the osteoclastic activity, increasing the osteoclastic activity, and it possibly helps in good bone health. It's also shown to have neuroprotective action through various pathways. It has also shown to have again almost the same thing on same pathways, but some benefit on the neuroprotective on these. They have shown some benefit of metformin on diabetic kidney disease in the early stages, but one should know that it is also contraindicated if the eGFR is less than 30. It has shown some benefit on the respiratory complications, decreasing eosinophil inflammation, increased insulin signaling, airway modeling, remodeling, immune cell activation, airway inflammation, airway remodeling, and through inflammatory markers and other pathways. Metformin and microbiota. It induces the alteration in the overall structure and function of the gut microbial community, leading to amelioration of the dysbiosis, which is associated with type 2 diabetes and subsequently of the host metabolism. In healthy people, metformin also affects the composition of the gut microbiota, which is independent of the dysbiosis induced by type 2 diabetes prevailing level of blood glucose. It has shown an independent effect on the dysbiosis. Metformin treatment is associated with increased level of Escherichia species and decreased level of the intestinal factor in both healthy and normal individuals. So good microbiota can improve. Metformin treatment in patients with type 2 diabetes and periodontitis were also associated with oral microbial composition. Its treatment alters the gut microbiota composition, which depends on the NPK in intestine and probably results from the modulation of expression of antimicrobial peptides, including regenerating islet-derived protein 3 gamma. Metformin enhances protection of the intestinal mucosal barrier function by increasing the relative abundance of this microbiota and the number of global cells and leading to thickening of the mucous layer. It also promotes the expression of tight tension protein and in the gut microbiota. As far as cancer is concerned, through various pathways, it has shown that possibly it is also beneficial and have been shown to be less in the patient where those who are metformin have less incidence of cancer. Exact mechanism again is not known, but hepatocellular carcinoma and NASH in patients with diabetes are found to be less. Aging, again, it has been proposed that it might improve aging, and I'm not going to go too much in detail, but they have data for prevention of cancer, renal protection, Alzheimer's, liver disease, and healthy aging as far as metformin is concerned. There are some environmental concerns when I was just going through this, is very important. Metformin is not metabolized and is eliminated unmodified by the human body. As such, approximately 70% of the therapeutic dose is excreted through urine and feces and is discharged to the wastewater. The accumulation of metformin in the environment is therefore predicted to be considerable due to larger number of people taking metformin, almost 0.5 to 2.5 gram daily. Based on the large volume of metformin excreted unchanged in the urine, metformin can be regarded as a prominent emerging water pollutant. The presence of metformin in the effluent of wastewater treatment plant has been used as an indicator of pharmacological contamination and is in the wastewater-based epidemiology study have actually they are using metformin as one of the marker of the pharmacological contamination. Due to low removal rate in most of these water treatment plants, metformin is consistently detected in the concentration ranging from nanogram to microgram per liter in these plants and even in the drinking water. The widespread occurrence of this compound and numerous organic transformation products generated by microbial mineralization and photolysis in the aquatic environment poses a global threat to the environmental health. And that is why it's of concern. However, the risk to humans is not being seen at this moment of time. And there are some restrictions of metformin if my time permits. So we have some lactic acidosis, though we have not, most of us have not seen lactic acidosis in as far as complication of metformin is concerned. But this is when normal lactic acid is around 0.5 to 1 millimole. When it goes more than 5, we call it lactic acidosis, and it could be sometimes life-threatening. The early signs could be myalgia, abdominal pain, malaise, drowsiness, diarrhea, headache, anorexia, and hypertension. Precautions, you have to use this drug very cautiously if patient is being posted for some clinical studies. Those who are excessive alcohol, stent surgery, elderly people, hepatic impairment, renal impairment, and any condition of hypoxia. Less than 30 eGFR, it is contraindicated. I had an interaction with Dr. Sundar Mudliar from US, who has worked really very hard on this reducing. Earlier, if you remember, earlier cutoff was 60, then it came down to 45, then it came down to 30 now. And he said, his category said that within the next 2 years or so, it will come down to 20, because the risk of ketoacidosis, what has been proposed because of lactic acidosis, because of metformin in CKD, is hardly anyone sees here. But certainly we have to be cautious, and at this moment of time, we should be sticking ourselves to avoiding metformin of eGFR less than 30. Hypoglycemia is not a risk for metformin, but if it is given to patients who are malnourished, strenuous exercises, alcohol intoxication, sulfuria, along with sulfuria or insulin, it might precipitate. Metformin can cause vitamin B12 deficiency, more common in vegetarian versus non-vegetarian. There are some drug interactions where it should not be used, like acetazolamide and diuretic, or zonisamide, or topiramate, and metformin may precipitate lactic acidosis as patients. Very important is diarrhea is one of the common side effects of metformin, but many of the patients are not being picked up as a metformin related diarrhea. So anyone coming to with any GI upset, also look into that and try to see that metformin tolerance is not there or there. It can have a diarrhea, indigestion, flatulence, nausea, headache, dizziness, flushing, and all. Gut microbiota is increasingly recognized as a potential mediator for GI adverse events of metformin. GI adverse effects of metformin intake has been attributed to gases, which such as CO2 and H2S, produced by the gut microbiota, seemingly through metformin-induced metabolic modeling. The use of microbiota modulators may be helpful in such patients like prebiotic or probiotics. So it's an anti-cancer agent, anti-inflammatory, immune-mediated disease, and aging. It can be used. So metformin is one of the most common medication which is used worldwide and has been used for more than 60 years. Latest advances regarding metformin glucuronidase mechanism of action has identified new potential factors. Although the anti-hyperglycemic effect of metformin are due to its exclusive action in liver, there is now strong evidence that extrahepatic sites of actions are also there, notably the gut and microbiota and some immune system. Metformin has an anti-inflammatory immunomodulating properties in various pathological conditions like cancer, inflammatory diseases, and diseases might be of some use, and that's why this is one area where we have to have more and more data to propose ourselves metformin into other indications. With this, I stop here. Before I conclude, wishing you all a happy Ganesh festival, happy Navratra, happy Deepossav, and stay safe, stay healthy, keep smiling. Always, always, always don't cut the cake, but cut the fruit for celebrating any occasion, and give another positive message to the society that all these cakes and cookies have hydrogenated fat, which is atherogenic to your endothelium. And so we at our center, as well as our all staff members, never ever cut cake or cookies or pastries, but we cut the fruit or we cut the watermelon to celebrate the birthday. Thank you very much for your time.
Thank you, Dr.